All right. Well, let us go ahead and get started.
Hi, Heather. Did you want me to share my screen? Yes.
Yes, please. Thank you. All right. Welcome to as mentioned, welcome to the May Health Innovation Community Partnership meeting. We're delighted, of course, to share some space with you today. Thank you, everyone, for your accommodation in moving this meeting from our first Friday to the second Friday in recognition of May Day last week. We know we had a lot of really important and special events happening around the community and thought we did not want to compete for your time and attention with HICP. But here we are today on May 8th, and we're ready to go ahead and get started. As we know, this meeting is being recorded via Zoom, and we will have that recording available for everyone on our hicpla.org website in about a week's time. We do want this to be an interactive session, so we invite you to please turn your cameras on if you're able, but please take advantage of the opportunities to share your thoughts with us, either by raising a hand, and we'll call upon you and let you speak with our presenters. You're also always welcome to take advantage of the chat. Please put notes and comments into the chat as well, and we will read those aloud for our speakers to respond to. Next slides. Let's go down to next slide, please. Oh, yes. And of course, we are presenting our presentations. We always employ an interpreter to provide Spanish language interpretation for our materials and our presentations. In recognition of that, we please ask to all of our speakers, myself included, to please speak clearly, speak at a modest pace, and please avoid jargon that may be very hard to translate or hard for the non-specialists to understand. So if you could please help us with that, that will really make this go more smoothly for our translators, allowing them to keep up with the conversation. Thank you. All right, so now we're ready to go. Let's take a quick look at our agenda. As always, we will start with a presentation from some of our wonderful staff at the Los Angeles General Medical Center. Then we will give you an update on our Community Benefits Agreement subcommittee work and how that is progressing to the HICP parent body. Then we're having a health presentation from the Los Angeles Office of Worker Health. Then we'll have some presentations about Mental Health Awareness Month. This May is Mental Health Awareness Month, and so we want to connect you to some of those resources and ideas and themes. Lastly, we will wrap it up this morning with a presentation from our campus partners, particularly the arts presentation of what's going on at the Restorative Care Village Phase 4 and 5. And Centennial partners will be sharing with you an update on their community plan presentation. So as always, a full morning ahead of us. As we begin, I'll go ahead and read aloud the HICP guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And of course, another wonderful moment in the May history is that we are celebrating Mother's Day. So we want to wish well to all mothers and mother figures out there in our community and celebrate you this month of May. And with that, I'm very delighted to welcome our colleagues from the Los Angeles General Medical. Nurses Sanossian, or Mariana Roman, and Graciela Magana are going to talk with us about, I believe it is Stroke Awareness Month and some of the services and resources that are available at our medical center. So please take it away.
Good morning. I will be talking about Los Angeles General Medical Center's primary stroke program. My name is Mariana Roman, and I am the stroke coordinator. With me is Dr. Grace Kuo, and she is the medical director of our stroke program. So May is Stroke Awareness Month. Stroke is now the fourth leading cause of death and a leading cause of disability within the United States. It is a time-critical neurological condition affecting the arteries leading to and within the brain. If you suspect that you or someone in your family may be experiencing a stroke, please call 911 immediately. Prompt medical intervention can save lives and significantly improve the likelihood of a successful recovery. Los Angeles General is one of the largest public teaching safety net hospitals in the nation. We are a primary stroke center that provides comprehensive, individualized quality care to patients with cerebrovascular disease. By leveraging innovative techniques and ongoing research, our physicians are continually developing advanced methods to diagnose, treat, and prevent stroke. The acronym that we use here at Los Angeles General is BFAST. So if you notice the signs and symptoms of stroke, such as an acute loss of balance, blurred vision or loss of vision in one or both eyes, if you notice a facial droop or an arm or a leg, a lack of movement or strength in an arm or a leg, if a person is becoming acutely altered or their speech is slurred, if you notice any of these symptoms, please, stroke is a medical emergency, so please call 911. We'd just like to do a brief shout out to our stroke program and the members of our hospital who contribute to the success of our program. So first and foremost, we want to thank the directors, so Dr. Nerses Sanossian, who couldn't be here today, Dr. Arun Amar, they are the co-directors of our stroke program. But we also work closely with our residents, our neurology residents. We work closely with our QI department to abstract the data and present it to the Joint Commission and AHA. So again, I just want to thank everyone who has made our program successful, and as we are growing in a positive direction, we are here for the community. We just finished up a community event this week where we did our annual sidewalk event, where we handed out educational pamphlets and prevention strategies to our community and staff members. And along the way, we gave like tote bags and other little goodies for the community as well, which were very well appreciated. So again, I just wanted to say thank you so much for allowing us to come on and just give a little snippet about our stroke program. Thank you so much.
Thank you so much. Yes, as we know, Stroke Awareness Month, it's obviously really important that people be familiar with the signs of stroke because I know speed is truly of the essence when you have a stroke incident. Speed is of the essence to get to a medical center so you can be treated and assessed. Do we have any questions or comments for Mariana? All right. I think, are we going to also talk about anything else that we're going to talk about? I mean, the hands-on CPR event that's coming up on Monday, June 1st. Is it for everyone in the community to come and join and learn how to provide CPR services?
I believe Graciela, I don't know if she's on this meeting, but Graciela Magana would have more information on that, but I can promote it for her if she would like. So basically, this weekend or in June 1st, there's a hands-only sidewalk CPR event going on, and this is for the community members as well, where because CPR is very important as even if you see a family member becoming acutely unconscious, quick CPR while you're waiting for 911 to arrive, it's very important and it does save lives and hopefully promote positive outcomes.
Yes, wonderful. Um, and so I think, is it something that do you have to register in advance, do you know, or can you just show up on site and receive the services?
Unfortunately, I don't know because this is not our program is not hosting this event. It would be Graciela's department.
Okay. So I
And I
guess
do apologize.
that's okay. We just encourage then to please use that QR code so that you can learn more about the event. I do notice that we had a comment in the chat asking about bilingual materials about stroke detection and early response. I'm assuming primarily Spanish language materials that would be available as well.
Yes, so we have pamphlets from American Heart Association in English and in Spanish. Also, we during our sidewalk event, we were handing out magnets with the signs and symptoms of stroke in English and in Spanish, and pillboxes. So, and we do have our materials both in English and in Spanish. So, especially for our population, which is primarily of Hispanic descent around our hospital as well. So, we make sure that our materials are targeted to our audience and that they understand the education and information that is provided to them. And we do have other resources as well at our hospital. We work closely with the Wellness Center and it is a community outreach center that offers services free of charge to our patients and their family members. They offer like free food, free transportation to doctor's visits. Um, they have a food drive. They offer services to for legal, social worker, financial, and even dietary. So again, we do provide a lot of resources for our community members because we understand that it is very difficult for them to get good quality medical care. And we want to, as we take care of them very well, when they get back out into the community, we want to make sure that they're well taken care of as well.
Wonderful, thank you. Yes, Mariana, if you would be so kind, maybe you could email me some of the materials that you mentioned that are their handouts or printout materials, and we could forward them out to our HICP membership as well as put them on our website as a material that reflects the presentation today. And I do see a note from Connie Castro that related to the hands-only sidewalk CPR event that everyone is welcome, no registration necessary. It's open to all ages, teens, adults, and seniors. So we definitely encourage you that if you want to learn more about CPR and emergency response or brush up on your skills, this is a wonderful time to come out and get some practice in. So that will be on Monday, June 1st from 10 a.m. to 2 p.m. in the courtyard of the Los Angeles Medical Center, Los Angeles General Medical Center. Great. Well, are there any other comments or questions for our Los Angeles General Medical Center team? All right. Well, we are going to move forward in our agenda. My understanding is we are going to bypass the CBA presentation for the moment, and we're going to move on to our LA County Health Silicosis presentation by Evelyn Escobar Gramajo. Evelyn, are you here with us? Are you ready to go?
Yes.
Fantastic.
Good
Welcome.
morning. Can you hear me?
Yes, we can hear you loud and clear.
Okay. There's my camera. So it will be myself and my coworker Frankie. So I want to have a little mic check with him. Frankie, are you here?
Yes, I'm here.
Okay. Okay, I can hear you. Perfect. Well, thank you so much for having us. So my name is Evelyn Escobar Gramajo, and we are with the Department of Public Health and the Office of Worker Health and Safety. Our office is relatively new, so maybe that's the reason why not a lot of people know about it. We focus mostly on occupational health, and our office is the first one in the nation. So we're very excited to be part of this office and to present to you guys today about silicosis. So let's get started. Next slide, please. Awesome. So at the end of this presentation, our goal is to increase awareness about silicosis and why it is an occupational threat to the health of workers, inform the Los Angeles County residents about the impacts of silicosis in our communities.
Evelyn,
Yes.
my apologies. I'm just going to ask if you could please slow your speech down a little bit so that our translators can keep up. Thank you so
That's
much.
true. Thank you for that reminder. Awesome. Yes, thank you. So inform the Los Angeles County residents about the impacts of silicosis in our communities, understand who is at risk, know the symptoms of silicosis, and learn about resources and information for silicosis prevention. Next slide. Next slide. So what is silicosis? So silicosis is an irreversible, preventable, progressive lung disease caused by inhaling respirable crystalline silica, or RCS, and also commonly called silica dust. Silica dust can cause lung inflammation, stiffening, and scarring, which can lead to the severe lung disease. It can take 10 to 15 years to develop. A person exposed to higher levels of silica dust may develop the disease more quickly. There are three types of silicosis: acute, accelerated, and chronic silicosis. It all depends on the levels of exposure to silica dust the person is exposed to. Next slide. Some of the health effects of silicosis. So extended exposure to silica dust, even at low levels, can lead to the development of silicosis. Chronic inflammation over time can lead to the significant worsening of lung function. So minimizing or removing the exposure can prevent disease later in life. So some evidence suggests that silicosis cases identified in early stages could be less likely to progress to later stages. Silicosis not only affects the body, but also the mental health of the person and their loved ones, unfortunately, because silicosis and other lung-related diseases often provoke feelings of anxiety and depression when a person receives their diagnosis. Next slide. Next slide. So what it is this dust that is causing all of these problems? So silica dust comes in different sizes, and the smallest dust particles in silica dust are called RCS. So these tiny particles are as small as 1 grain of salt cut into 20 pieces. So you can already imagine it's very, very, very tiny. The RCS's tiny size allows it to be inhaled deeply into the lungs. The larger dust particles might not make it to the lungs, but it could land in other parts of the respiratory system and cause other health issues as well. So exposure to silica dust over an extended period, even at low levels, can lead to the development of silicosis and other health problems. Next slide. So RCS comes from crystalline silica, which is a mineral found in quartz, marble, granite, stone, bricks, tile, sand, concrete, cement, some plastics, and other construction materials. So as you can see, much of the earth is made out of silica, but quartz is the most common form of crystalline silica. Next slide. So materials containing crystalline silica can release silica dust into the air that can be breathed in by people who are cutting, sanding, breaking, drilling, smashing, and grinding the material. Next slide. So crystalline silica is a class 1 carcinogen that can cause lung cancer and increase the risk of other health problems like kidney disease, autoimmune disease, lupus, rheumatoid arthritis, active latent tuberculosis, other lung diseases like emphysema and asthma. Next slide. Because quartz countertops typically contain more than 90% silica compared to other materials, workers who cut artificial stone or natural stone that contains high silica levels are at the greatest risk. Artificial stone, quartz, and engineered stone are names that are used interchangeably when talking about this type of stone for countertops. So that's the reason why when the person gets their countertop at their home, it's not it won't cause any issue to the person who owns it. Like once it is installed, it doesn't cause any harm. The only issue is when it is being fabricated. And that's the reason why the workers are the ones that are at risk for this disease. Next slide. And as you can see here, as of May 7 of 2026, there has been 556 fabrication workers identified with silicosis in California. The majority are in their 30s and 40s, mostly immigrants from Mexico and Central America. Many are underinsured or uninsured, and there has been at least 31 deaths, at least 58 lung transplants, and out of the 556 cases in California, 283 are in LA County alone. Asian and Armenian immigrant workers in this trade are also at risk of getting silicosis. However, no cases have been reported to the state at this time. Next slide. So more than half of the silicosis cases are in California are in LA County. The area in LA County with the most cases of silicosis is in the San Fernando Valley. These workers are community members, father and spouses, and this skilled trade is how workers make a living and support their families. Next slide. And right now we're going to hear this story of Ever, and we're only going to play part of it. We can put the link in the chat so you guys can finish listening to his whole story, but we're only going to play about 3 minutes and 35 seconds of it. Thank you.
Sorry, give me 1 second.
Yes, thank you. I think the audio, I cannot hear.
That's right. When you share video, you'll have to click the audio button, Elijah. I think you're gonna have to stop sharing and reshare maybe. And then when you reshare, there's a button that you have to click for audio to be shared as well.
Mi nombre es Ever Ramón. Yo trabajé por 16 años en esa compañía. Bueno, en realidad el trabajo es muy bonito. A mí me gusta mucho el trabajo, pero yo creo que uno como trabajador no se da cuenta que el trabajo así como es de bonito, así es de dañino también. Y eso nadie se lo explica a uno. Nadie.
Nobody.
Porque primero estamos
Because
trabajando
first
nomás
we
con
were just working
granite
with
y
marble
mármol,
and
que
granite,
es natural,
which is
pero
natural.
luego
But
después,
later
al
on, we
tiempo,
started working
empezamos a trabajar con, que le llaman Engineer
with
Stone, que
what is called
trae,
engineer
pues,
stone,
mucha
which contains
sílica,
a
y
lot of
yo estuve
silica.
viendo una vez
And
que
I
también
was
trajo,
watching
y
when
vi
a truck
un
brought it,
sticker,
I saw
y me
a
puse a
sticker
leerlo,
and I
y
started
ahí vi
reading
que
it.
decía que era peligroso porque
And it
se
says
podía
that it
alojar en
was
los pulmones
dangerous
y era muy
because this
dañino.
can launch in the lungs, because it was very dangerous.
Después de cierto
After a
tiempo,
certain
fue
time,
que yo
I
tuve
had
un
an
accidente,
accident.
me caí en
I
el
fell
trabajo,
at work.
me lesioné mi
I
espalda,
injured my back,
pero
but
fui
I
al
went to the
hospital.
hospital.
Estando en eso,
Being in the
me vine
situation,
para
I
la
came
casa y el
home,
siguiente
and the
día
next
parece,
day, it
yo
seems, I
estaba
had
con
a lot of
mucha
phlegm
flema
in my
en
throat,
mi garganta, en mi boca,
in my
mucha
mouth,
flema
lots of
y mucha
phlegm,
tos.
and a lot of
Entonces
coughing.
yo
So
fui
I
al
went to the
hospital y
hospital,
dije al
and I told the
doctor,
doctor I wanted to see
que quería ver por qué tenía tanta
why I
cosa
have
de
so
esas. Y
many of
dijo,
these things. And he
pues
said,
no sabemos,
we
pero
don't
te voy
know,
a
but I'm
referir
going
para
to
hacer unos
refer you to
exámenes.
do some tests.
El
The
siguiente día
next
yo estaba
day,
para hacer
I
los
went to
exámenes de
have my
sangre todo
blood
en el
test done,
hospital cuando me
everything at the
llamó
hospital, when
la
the nurse
enfermera y
called
dijo
me and said that I needed to
que yo
go
necesitaba
to the emergency
ir
room.
de emergencia. Disculpe, está duro para mí.
Excuse me, it's hard for me.
Porque yo sí me afligí mucho.
Because I did
Pensé que
grief a
ya
lot.
era
I
pues
thought that
muy
was
corto
my
el tiempo.
time. I was
Y
already,
y
And
Después me
then
dijo,
he
lo que
told
tienes
me,
es
what you
sílica,
have is
silicosis.
silicosis.
Y yo le dije, ¿qué es
And
silicosis?
I told him, what is
Es
silicosis?
una cosa
It
por lo
is
que
a
tú
thing
has
that you
estado
have been
absorbiendo mucho
absorbing
polvo
through
en
dust
tu
at
trabajo.
work.
Y
And at that
yo en ese
moment,
momento decidí
I decided
dejar
to
el
quit my
trabajo. A mí nadie
job.
me dijo que lo
No
dejara,
one
pero yo
told me to
dije, pues yo voy
quit,
a
but I
salvar mi
said,
vida.
I am going to save
Nunca
my
me
life.
imaginé
I
que
never
mi trabajo me
imagined that
fuera
my
a dañar
work would
tanto.
harm me so much.
Pues
Well,
sí, me
yes,
afectó
it
mucho
affected me a lot
emocionalmente
emotionally
porque pues si
because if he
él sufre
suffers
lo que él sufre también
what
yo
he
sufro
suffers,
porque
I
pues lo
also
que él
suffer
siente
because
pues yo no
what
tengo
he feels.
la
I don't
enfermedad
have
que
the
él tiene, pero pues sí
illness
me
that he
afecta
had, but
muchísimo.
the truth, it
La
affects
verdad,
me a
y
lot.
pues para mí
And
ha
for me,
sido
it has been very
muy
difficult.
difícil, la verdad, y
That's the
él
truth. Because
a
he gets
medianoche
flame at
las flemas, él
midnight,
se levanta, él
he gets
tose
up, he
mucho,
coughs a
le
lot,
da
he
mucha
gets a lot
tos
of cough.
y
And
los
the burn
ardores
in his
en
stomach,
el estómago, él se le sube
things
cosas
come
aquí en
up
su
here in his
garganta.
throat.
Él dice que por
He says
por
that
la
because
enfermedad que
of that,
tiene y
the
pues
illness
sí,
that
él
he
pues
has, he does
sí
struggle a
batalla
lot
mucho
with
con
it.
eso, la verdad.
Thank you. Perfect. So as you can see in this video, people, not only the worker is being affected, but also the family as well, and the symptoms that they experience are really bad. So we can talk about the symptoms now. So for the early stages of silicosis, the workers might not experience any symptoms. But for the intermediate stages of silicosis, a worker can experience persistent dry cough, shortness of breath, and chest pain, extreme weakness and fatigue, loss of appetite and weight loss, fever, night sweats, leg swelling. And then the later stages of silicosis, the symptoms could be the bluish discoloration of the lips. So unfortunately, often by the time people are experiencing severe enough symptoms that drive them to the doctors or emergency room, their disease is already pretty far advanced. For example, the median age of diagnosis is 46 and the median age of death is only 52. Next slide. So if you know someone that has symptoms of silicosis, encourage them to make an appointment with their healthcare provider. There are other diseases that can cause similar symptoms. Symptoms can resemble those of common illness, including colds, flu, asthma, COVID-19, or tuberculosis. So the person needs to be evaluated to determine the cause of their symptoms and seek medical attention for them. Let the doctor know that they work with materials that exposes them to silica dust. This is very important that the worker mentions that they work in the industry. And if you don't have a doctor, or if they don't have a doctor, they can call 211 or the info line 833-540-0473, and they will help them find a healthcare provider. We can go to the next slide, and I'll pass it on to my coworker, Frankie.
Great. Thank you so much, Evelyn. So I'll be talking about, I'll do the rest of the presentation, and we'll start off with diagnosis. So there is no specific test for silicosis. So multiple provider visits and tests might be needed in order to diagnose a worker with silicosis, because it can be often confused with other illnesses, just like it was mentioned earlier, with tuberculosis or other similar diseases that have similar symptoms. So a physical exam and a detailed work history are very important to be are crucial to the doctor. But some of the common medical screening tools include a chest X-ray, a CT scan, a spirometry test, and a diffusion capacity test. Next slide. And then treatment for silicosis. Unfortunately, there's no cure for silicosis. In a few cases, a lung transplant can extend life on average to only about 5 to 6 years, but we know that a lung transplant can be very difficult because it is a lengthy process and not everyone can be eligible for a lung transplant. However, doctors can treat symptoms to provide some comfort, like oxygen therapy, inhalers, or any other types of medication. Next slide. Now, workplace protections. So in December of 2024, Cal OSHA, which is the state agency that enforces workplace protections for all workers, for all California workers, approved a permanent silica standard that builds on the December 2024 silica emergency rule. And so what this does is that it helps to improve worker protections with better safety measures, improved monitoring, and a better reporting process. And what this standard covers is it covers all occupational exposures to respirable crystalline silica or silica dust, unless it is exempt. And it includes performing all high-risk tasks, for example, within regulated areas with defined barriers and clearly identified with warning signs in the workplace. Workers have to also use good housekeeping and hygienic practices, and then they have to it is prohibited to use pressurized air, dry sweeping, or shoveling to clean surfaces. But for more information on this particular state law, you're more than welcome to visit Cal OSHA's website, email their consultation services, or you can call your local district office here in Los Angeles or in the San Fernando Valley. Next slide. And so how do we prevent silicosis? Um, so employers are required to provide workers with training and on how to identify tasks that expose them to silica dust and how to prevent exposure. They must also supply tools and equipment that use water for wet methods when cutting stones such as artificial or natural stone and when cleaning the workplace to reduce dust. In addition, employers must provide access to a health provider for medical evaluations or medical screenings at no cost to the worker. This is required by law, by state law. Um, Safe work practices include never cutting dry, always using tools that release enough water to control dust, and using ventilation systems that remove silica dust from the work site. And examples of these types of tools are on the slide as examples, such as you see, someone's cutting a countertop, um, and then a tool that's releasing water, that the attachment is attached to the tool that's releasing water. And then you can barely see it, but a worker is cutting artificial stone and the dust is being pulled directly away from them using a ventilation system. Next slide. Um, Hopefully these videos play, but um, both of these videos, you on the left, you'll observe a cloud of dust when there's dry cutting involved, versus on the right, when a worker is using water, there is no dust, little to no dust being produced. I don't think they're playing, but that's okay. Yeah, so we can go on to the next slide. It's fine. So in terms of other prevention methods, just like I mentioned before, do not cut materials, especially artificial or natural stone, without wearing the appropriate respiratory protection. Employers must provide respirators at no cost to the employee or the workers, and Cal OSHA requires the use of a powered air purifying respirator or a PAPR. Um, and it has to be well fitted. A worker has to shave their beard or mustache also for it to have a good seal. An example of a PAPR is seen on the slide on your screen. But sometimes we'll see workers using um, a surgical mask or an N95 respirator or even a cloth mask when we're conducting outreach, and those do not provide adequate protection at all. Next slide. And so other than respiratory protection, it is also recommended for using other types of personal protective equipment, such as eye protection, which it can be embedded in the mask or the respirator that the worker is using. They can use goggles, non-slip footwear, work suits, aprons, coveralls, gloves, and ear protection as well. Next slide. And so we'll just quickly talk about some healthcare resources that are available. So we do have a website available by the Los Angeles County Department of Public Health, where you could just find out more information about what is silicosis, and get some of the educational materials that we have available that we use during outreach. You can also call 211 LA to be connected with healthcare provider and other services, or you can connect with the BILA network, which offers support to help determine whether folks qualify for various other assistance programs. Next slide. There's also mental health resources available. The Los Angeles County Department of Mental Health has a 24/7 helpline, and then there's also the 988 suicide and crisis lifeline too. Next slide. And then there's also workplace resources. So Cal OSHA, the state agency that enforces laws, has a consultation services. So if anyone has any questions about workplace safety and health questions, they can call them at their local district office, or they can email consultation. If a worker or someone does call consultation services, they will keep employer names and locations confidential, or employee names and locations confidential. Next slide. And here's just more information from the Department of Public Health, our public health info line. You can visit our website, send us an email, or you can also follow us on all our social media, such as Facebook, Twitter, and YouTube. Next slide. And that concludes our presentation. Thank you so much. If there are any questions, please let us know.
Thank you so much.
I see a question on the chat if you want me to address it. Yeah, if anybody else has any other questions, they can put it in the chat or come off mute. I was typing my answer, but I can quickly mention. So Frankie and I do outreach throughout LA County, and we go to the fabrication shops directly to speak with the workers about what silicosis is, if they don't know what silicosis is, about the symptoms, the things that they can do to stay safe, encourage them to use, like Frankie was saying, like the pepper, to use water, to not use compressed air. We also, if some of them already kind of have experienced some, are experiencing some symptoms, then we encourage them to go to the doctor, to the emergency room, and just kind of like tell them a little bit, like, you need to emphasize that you work in that industry, so the doctor or the nurses can like know about this, and hopefully they can do a test that would like diagnose them for or see if they have silicosis. So hopefully that answers your question, Christina. I don't know if people have any other questions, but thank you for having us.
Thank you so much. Really appreciating the presentation. It's obviously a heartbreaking condition for those that experience it, and very sad that that so many people are affected. But it's wonderful to get the message out there so we can, the legislation will prevent hopefully future incidences, and people who have this condition can get good care. Thank you so much to kind of fill in the gaps of how the outreach is conducted, how you're connecting to people who may be suffering this or exposed to this. Do we have any other questions or comments for our presenters? We have a question. Are there condition-specific support groups for individuals impacted?
Yeah.
Oh, sorry. Yeah, go ahead, Frankie.
Yeah, so you're more than welcome to get connected with us, so we can connect you to the right resources. But then the Department of Mental Health does have a support group for workers who have been impacted by silicosis, where we can plug in some of the DMH resources, but we can also follow up with the facilitators and organizers to share some of the materials that they have available, so you can all get connected as well. Thank you so much for the question, Diego.
Yeah, thank you so much. And then I did see a hand up from Alejandro Castro. Alejandro, would you like to ask a question?
Solo un comentario. I just have a comment. Thank you so much. My name is Alejandro Castro, and we work here in Community Health Center, and we're using this resource to enrich the community. We're visiting different spaces, and we're using this resource that you're giving us.
Perfect.
Thank you so much.
Alejandro, and that's great. Yes, so again, just talking to the workers sometimes themselves, it's really difficult. Like sometimes we cannot know where they are, or somebody made a comment here, the installers that cut on the side, or like they are just cutting on someone's porch or things like that, right? Like maybe we might not be there the day that it's happening, but also, educating the community and the community being aware of this information is important too, because they can definitely like help us spread awareness about it. And in the Latino community, more than anything, like we all know someone that is in the industry, whether it is in the stone or even in construction, because they're also exposed to these silica levels. We can all let someone know, like, hey, you have some symptoms, or you work in this industry, like make sure they're using water, have that type of conversation. So yeah, this information helps with everybody. So thank you for sharing the information with the community, because they can definitely help share that information with the workers as well.
And Carla, would you like to ask your question?
Yeah, actually, I just wanted to add to this wonderful presentation. So informative, so important. I think it's also just a nice opportunity to say that, silicosis is such something that we need to be aware of. But I think also exposures at the workplace in general are very, very important, and even at home. I will say, as a former primary doctor and now in urgent care, we take the history of the patient very seriously. And if we're asking about what kind of jobs you held and, what was life like when you were growing up, I ask about exposures to like smoke, if you were using an open stove with a wood fire. All of that is super important. So, I know that we cannot eliminate risk factors, but it's always actually a really good idea to wear that protection, and talk to your doctor about what it could be, whether that be a mask. I mean, something even as simple as wearing goggles. And then, it's hard to switch, like, the stoves that some people need to use, but those are things to think about. And can we do anything to mitigate those exposures? So, but thank you for this presentation. It was phenomenal.
Oh, thank you so much. And that was perfectly, your comment was perfectly. So yes, thank you for that. So yeah, that's what we try to encourage these workers, and also just for construction as well, because the cement does have silica. It's a low levels, but they're still exposed. So just to use water. So if you see somebody that is coming to work at your house, let them know that they have to use water. They use the respirator. Also yourself, if somebody's working near your home, the exposures, in order to develop silicosis, it has to be like a long period of time and for various hours, because the workers are working like 8, 10, 12 hours a day, like the whole week for years, right? So that's the reason why they could develop silicosis. But yeah, so like you can encourage your family members, your community members to use a mask, to use water, and stay safe. So thank you so much for that comment.
Well, thank you again for the presentation. Obviously, it struck a strong chord, and everyone's very grateful for the information and, of course, the work that you're doing that backs it all up. There's some wonderful comments in the chat as well about how you are reaching out to those affected workers and, just keeping us apprised of what's going on. So thank you again so much for the presentation. We really always appreciate hearing from our wonderful colleagues at the Department of Public Health. And with that, we will move on to our next presentation in the queue today, and that is by our colleagues at Alma Family Services to speak with us about mental health awareness, the Mental Health Awareness Month, and some of the opportunities and services that we can lean into during this important month of awareness and healing. Diego, I'll let you take it away.
Thank you, Heather. So good morning, I'm Diego Rodrigues. I'm the Executive VP and COO of Alma. And I'm pleased to be joined today by Mayra Castaneda, our Clinical Program Manager, and Matthew Decena, a Clinical Social Worker, who will be presenting alongside me. I also just want to acknowledge Yolanda Duarte is with us, who is Alma's board chair. She's a founding member of the HICP and a champion for mental health and wellness as well as part of the Alma team. We appreciate the opportunity to present today. We are going to talk about trauma, grief, and ways we can move towards hope. And I want to acknowledge the very moving interview that we just watched and presentation that we just watched. And my thoughts are with the Ramon family and so many families that are going through a similar tragedy, truly, to have such a condition and to have their livelihoods impacted. And we know that this type of trauma impacts not only our vulnerable community members, but also those that are serving them. We know that many of you are doing critical work out in the community. So this presentation today is for you as well as helpers, because we all experience trauma, grief, loss, and now more than ever, we all need to move together towards hope. But before we begin, I just want to very briefly share about Alma Family Services and why this work is so important to us. Alma was founded in East LA in 1975. We celebrated our 50th just last year. And we started with the commitment to provide culturally responsive, community-based care. Alma annually serves more than 18,000 individuals across 17 service sites throughout LA County, the city of Los Angeles, and a small clinic in Riverside County. We are proud to be founding partners of the Wellness Center, where we have provided behavioral health support, outreach and engagement, resource navigation, and youth development services for the past 12 years. And we have also led alternative to deportation case management services. We work closely with families that have been impacted by ICE. Many of the individuals and families that we support and provide individual psychotherapy to are patients of the LA General Medical Center, and this is their medical home. So because of this, we have seen firsthand how mental health, healthcare access, immigration stress, family instability, and community trauma intersect in people's daily lives. Our presence on site and the trust of our partners has placed Alma in a unique role, not only as a service provider, but as a long-standing community stakeholder who is invested in healing and resilience in our region. So during the month of May, we have partnered with different organizations over the years to reduce the stigma of mental health, to enhance visibility of resources, and to inform and empower the at-large community. We recognize that talking about mental health challenges, especially trauma, can be distressing. And today may touch on topics that may evoke emotions or memories, even for us, once again, for the helpers. We know that right now, our communities are experiencing extreme stress, social, economic, and systemic stress. For immigrant communities in particular, there are additional layers of uncertainty, fear, and cumulative stressors. And we are not just witnessing, right? We are holding it, we are absorbing it, and we are responding to it every day. So we'll get started with Matthew, who will talk to us about recognizing the impact of trauma, not only on the people that we serve, but on the entire community, and very tangible things that we may be able to do to address trauma, grief, and loss. So, Matthew.
Yes, thank you, Diego. Would we be able to get slide 4 as well, please? Uh, I think it will be the next one. So trauma. So what is trauma? I think when we hear that word, we hear it so much, today. It's with every little thing, every big thing, and it's something that's in our vocabulary. So I think trauma itself, it isn't about the event, but it's about the impact or the experience that it has on a person, right? Their sense of safety, their stability, their well-being. I think it's important to note that trauma, it can overwhelm our ability to cope. It can affect how we think, how we feel, even the connections that we have with others, and especially how we move through the world, through our day-to-day life. Um, and we want to recognize that there isn't just one form of trauma. There's different forms that trauma can take. And it's important to recognize that people, they experience more, they at times can experience more than one type of this trauma at the same time. And so we'll look at the different types of trauma. So in our next slide as well, we'll see that we have acute trauma. This kind of refers to a single overwhelming event, something sudden like an accident or an act of violence. Then we have that chronic trauma. This involves in repeated or ongoing stress. We see this a lot in communities, whether it be with community violence or long-term instability. We then see complex trauma. This usually develops from multiple traumatic experiences over time. Um, Often comes from beginning early in life and then impacting developmental uh, and relationships. We then have historical trauma, refers to trauma that's passed down generations, often tied to systemic discrimination or oppression. This is kind of like what I see and what I usually work with. I work with children, and usually the trauma that their parents face, they also kind of hold on to it. So it's something that we see in our community as well. And then we see it collective trauma. That's the one that's in the red box. And we want to acknowledge collective trauma, especially because with everything going on in our communities right now, it's important to notice that this trauma comes from ongoing stressors, um, whether it's systemic inequities, community violence, or even immigration-related fears. And it's layered, it's repeated, and it's shared across families and generations. Again, a lot of the families that I work with, you hear a lot of the same fears, a lot of the same trauma. So it's something that we see. And it's important to understand that trauma, it's not individually. It's also within a broader community context. And for us as helping professionals, trauma, it's not only something we witness in others, but it's also something that we absorb through the work itself. I was listening to the stroke presentation and the silicosis one, and I can't imagine working with people who have dealt with a stroke, families who have a loved one who maybe passed from us, and that can be traumatic as well. Hearing their stories, hearing their experiences, and so that specific type of trauma has a name. And so in our next slide, we'll see that it's referred to as vicarious trauma. So vicarious trauma, it refers to this emotional impact of being repeatedly exposed to others, people suffering, grief, fear. And I think as um, people who help out in the community, it's something that we maybe hear on a daily basis, on a weekly basis, monthly basis. It's something that we hear every day. And so over time, we can all feel maybe emotionally exhausted, we feel overwhelmed, we feel detached. Sometimes we even feel numb. And I want to I want to bring out that we feel this, and it isn't because we don't care. Because I'm sure we all want to make sure that the people we're serving, they're getting the best care. And that's why we feel these different type of emotions, because we care so deeply. It's like we're going from one traumatic experience that we're listening to, and then we gotta lock in, we gotta focus to the next one. And then so we don't get that time to process it. And so it's something that's very common in our line of work, in social services, in healthcare, education, outreach work. I heard some people do outreach work as well, and even community-based settings. And people refer to this as compassion fatigue, and it can really impact us on carrying this trauma exposure over time. And trauma from different sources can manifest in many and shared unique, or trauma from different sources from what we've just shared, maybe it's in the education field or in the healthcare field, can manifest in many shared and unique ways. And so we'll see what the effects of trauma are. So trauma can show up emotionally, it can show up mentally, physically, behaviorally. We see those different ways that it can show up in our personal life. And people may experience different symptoms from dealing with trauma. We see a lot of anxiety, anger, hypervigilance, difficulty concentrating, sleep changes, exhaustion, or even just emotional shutdown. And there are many ways that trauma can manifest as well. It isn't just one specific way. Everybody who experiences trauma experiences anger, or everybody who experiences trauma experiences difficulty concentrating. No, it looks different for each and every one of us. And it's important to know that there's sometimes our reactions are misunderstood, right? It's sometimes there's this resistance, there's this avoidance, we become disengaged, and it isn't because we want to, but this is the way that our body responds. This is our survival response. We don't want to build relationships because we're already thinking about our last one, that maybe somebody passed away, somebody left, and that experience was traumatic for us. And so one of the most important things that we can do in moments of stress is help regulate our nervous system. And my supervisor Myra is gonna kind of touch into that a little bit later, but that's important for us to do. We want to make sure that we understand this connection with our body, with what's going on, our experiences. And so in our next slide, we'll see from trauma to grief, we want to understand that connection as well, because they both play a role. And so research shows that trauma and grief, they're connected. Trauma often involves a sudden loss, a loss of safety, maybe a loss of stability, certainty, or even our expectations. And then grief is the process of adapting to that loss. So we see that correlation, and they share many emotions, right? They share sadness, anger, confusion, and even fear. But grief is also part of that healing journey, and healing, we know that it isn't linear. I think something that sticks out is, somebody can be grieving for 7 years, they can be grieving for 10 years. It isn't there's not a cutoff date. It's not like, okay, well, 2 years pass, you should be good, you can move on. It's important to note that our timelines are different for each and every one of us as well. And so we want to reframe grief as a process, and we want to understand healing as something we move through over time. And it can be incredible. It can be important to look at it that way. We take small steps towards that progress. We take small steps towards that hope. But we also want to note that trauma can also remind us of the importance of love, of connection, of belonging. And it isn't about romanticizing this pain that we feel, or that other people are feeling, but it's about understanding how people can find meaning and connection even after experiencing difficult experiences, or having a difficult experience. We want to be there to support them, right? We want to be there to listen to them, to console them, to hear their experience. And sometimes again, hearing their experiences can cause that vicarious trauma. So what helps people begin moving through trauma and grief? So we'll see dealing with trauma and grief on this next slide. Trauma and grief, it can feel overwhelming. And during difficult moments, it can be hard to imagine things improving, right? You're already thinking about the worst case scenario. You're probably already thinking about the next dramatic moment that's going to happen. It's hard to look on the bright side. So our focus when working with clients and the communities is to promote this healing and hope. And I want us to note that hope doesn't mean that everything's going to be okay. Like, oh, don't worry, we're going to get to your highest point of your emotions. No, that's not what it means. It means that we're finding a way to move forward. And one helpful strategy is to like gently start reframing our thoughts. So instead of thinking, I'll never recover, I'll never be the same again, things are, at the worst they can possibly be, we can shift towards healing takes time. I'm taking small steps forward. We want to be kind to ourselves. Connection also matters deeply. Supportive relationships, counseling, trusted friends, community spaces, all of this, it can help us to reduce this isolation that's so easy. It's so easy to just want to be in bed on your own, isolated. So by having this sense of community, it reminds us that we're not alone. The people that we're working with are not alone. We're able to help. We're able to offer that help. Another thing that helps as well is restorative activities. It can help regulate our emotions and it can build this resilience. And then these activities can include movement, creative expression, mindfulness, spirituality, or even spending time out in nature. But most importantly, it's we want to keep in mind that healing often happens through little small victories, getting through the day, asking for help, setting boundaries, simply continuing to show up. There's no single way to heal, but there's some common strategies that can help. So we see talking to someone you trust, writing or creative expression, grounding practices like breathing exercises or mindfulness, and even practicing self-compassion and patience with ourselves can help us take those small steps towards those small victories. And so now we'll see what we can do as well. My supervisor, Myra, who always talks about self-care, is going to help you and discuss self-care now.
Thank you, Matthew, for the introduction. As helpers, we often focus on others, but we also need we also need support. Setting boundaries, taking breaks, and asking for help are essential, not optional. Taking care of ourselves is part of taking care of others. And as you can see here, some examples that Matthew had mentioned is setting boundaries, taking breaks, and seeking support. These are some principles also that we can apply in supporting others. Moving on to the next slide, please. Now, one of those examples is belly breathing, grounding exercise. So sometimes when we get upset, we're overwhelmed, we forget to breathe. Or we take a short breath, shallow breaths, maybe like a puppy panting. That doesn't give our bodies the oxygen we need. To help others and ourselves feel relaxed and calm, we can practice belly breathing. Belly breathing is when you breathe in slowly and deeply. You count from 1 to 5 as your belly and lungs fill up and the air, and you watch your belly move, and then you let the air out even a little slower, and you count 1 to 6. Watch your belly go back in a slow air. Slowly push out. Pay attention to the air as it moves in and out of your body as you count. And some of these examples, when we use with children, when I was a clinician at the Wellness Center, the kids with speed, right? They were so used in breathing really quickly or speaking really quickly. And so this is a friendly reminder that, we need to step back and kind of just take a deep breath, and being able to um, think what's going on right now. And so being able to do this is going to help us be able to support other families and support ourselves as in the helping profession. When supporting families impacted by trauma and safety, connection matters most. Children don't always express distress with words. Sometimes it appears as though behavior withdrawal and irritability or difficulty concentrating. Creating a safe space, a predictable space, a compassionate environment can make a significant difference. And so this is just an example of the deep breathing and how we can incorporate it in supporting families and supporting ourselves in this helping professions. And then just continue, to self-care. I will hand it over to Diego to finish this off.
Thank you, Mara. And we want to be very mindful of time, but as I started, right, we, before this presentation, heard about stroke response and prevention. We heard about silicosis and how traumatic it can be for so many families and communities. We're now talking about different types of trauma. So I know you are all extremely busy and you're all in places and spaces where you might not be able to take a break and take a moment for yourself. But if I may ask you for quite literally, take 30 seconds now and with me, just notice where you are. Hopefully you have your feet on the ground. And if you, I'm not gonna ask you to close your eyes, I'm not gonna ask you to, but if you can just be where you're standing right now and just breathe with me for a second. As we come to a close, if you can breathe, and as we slow your breath, we're gonna breathe in hope, and we're gonna breathe in peace, and we're gonna hold our breath for 5 seconds. Can we try that? 1, 2, 3. Breathe in, hope, and hold. Breathe out slowly for 6 seconds. 1, 2, 3, 4, 5, 6. Let's try that again. This time, think of something that you're grateful for. Think of something that is a source of resilience for you. So we're gonna breathe in gratitude. Are you ready? 1, 2, 3. Breathe in and hold. 1, 2, 3, 4, 5. And breathe out now. Breathe out fear and anger. 1, 2, 3, 4, 5. Thank you. I strongly encourage you to do that at least a couple of times a day. I do it myself at the beginning of the day is what helps me through the day, especially during stressful moments. And something as simple as breathing and slowing down our breathing can help us just stay in the here and now and realize that there is help available, there are resources available, and that we are not alone. So I want to close with the very final slide. There are many resources across LA County. As you see in the slide, we have crisis and immediate support through 988, which is a suicide and crisis lifeline, through the Department of Mental Health, through 211. We also highlighted the Department of Mental Health's website, Alma Family Services, of course, which is at the LA General Medical Center campus at the Wellness Center, providing individual psychotherapy, youth development, outreach, engagement, case management, as I shared earlier. There's NAMI and other organizations that are offering support, not only during the month of May, but throughout the year. And ultimately, we just want to reinforce that it's important to remind community they are not alone, and we are not alone. The healing takes time and takes a community and takes collective support, right? But through research, we know that even small acts of care can be extremely impactful and can help people move from a place of despair to the here and now, becoming able to move towards hope. So thank you once again for the work that you do every day to support individuals, families in our communities. We hope that you can continue to help us and support us address the stigma of mental health, normalizing care and support for families. And we stand here as a resource and as a thought partner in support of community. Thank you.
Thank you so much, Alma team. All of you gave us some really wonderful, thoughtful things to consider this month and ways to practice self-care. I really think that this could not be more timely for many of us. So very, very much appreciated. Any comments or questions from our attendees?
Heather, I see a question from Ari in the chat. What are the best practices for helping young children deal with change, especially a new school? So, Ari, there are a number of different interventions. As therapists, at times, we will help with gradual desensitization to stress with children. That's very important. So really talking through the new, but also acknowledging the change, right? Acknowledging the loss of friends, of the favorite teacher, right? That one favorite spot at the school site. And then helping them really map things out, their new school, and navigate their new school. And find a new favorite thing about the new school. And find the allies, right? Who are the teachers or the school representatives that can be a positive adult presence, right? To help them with social skills so they can make new friends. Find them after school clubs and activities so they can get engaged, right? And ultimately help them express what they're going through with the change, right? And allowing them to experience the change in a age-appropriate manner. Because children, as we all know, right, they will experience transitions differently at times than as we would as adults. And as adults, that's easy to forget at times, right? We think like, well, it's been a few days, it's a new school, isn't this great? But for that child, that might mean, no, my whole universe, right, where I existed, has now shifted. The ground has shifted, right, below me. So really giving them time to go through the transition in an age-appropriate way, and using different interventions to help them quite literally ground themselves into this new space and giving a new meaning, right, to moving into this new space. But thank you for your question. It's an excellent question. It's something that I started as a school-based therapist about 20 years ago. And some of my fondest memories is working with kids going through transitions from, not only from schools, but sometimes, family transitions as well, with family separation, and just being there with them as they went through those changes. Any other questions?
Oh, Yolanda, would you like to make a comment?
Yes, thank you. I want to piggyback on Diego's fine remarks. Much like adults who perceive themselves as who they are, as what they do, that's very similar with children. They are ex-grammar school attendees, and that's their role. So just like retirees who have to ease into a new perception of themselves, that's what the children are going through, and we need to allow them time to really miss and actually mourn the loss of their friends in a way that is a new, as Diego said, bringing up new experiences, finding out the new places at the new school that they can then identify with. And even so simple as finding a pebble at the new school and putting it in your pocket and saying, this now makes you a part of this school, and they can rub it through the day, carry it with them until they need not to do that again. But hopefully that helps Ari with her question. Thanks. And thank you all three for doing such a marvelous job. This was, believe it or not, I just spent 4 days with a facilitator about handling difficult conversations. And one of the very first things they taught us was to stop and breathe. So perfect. Thank you.
Thank you for the living testimonial, Yolanda, to the power of this kind of work. Very, very much appreciated. Let's see. Yeah, I think everyone's just very, very grateful for this sharing and this time together to kind of explore some of these tools and techniques. Greatly appreciating that. Okay, any other comments or questions from anyone? All right. Well, with that, we will move on in our presentations for the day. We are going to pivot into giving an update report on the Community Benefits Agreement Steering Committee, the work of the Steering Committee, which is a steering committee under the HICP. So I think Rosa Soto is going to give us the update today. Rosa.
Hi, everyone. Good morning. I'm so moved from this last presentation, just really appreciating that there's an art to a lot of the work that is done in communities. I mean, we talk about healing in many different ways, but I just wanted to appreciate the space that I can speak from my personal experience that I was put in, with the presentation, and, just wanted to appreciate Alma and your partners for, having that intentionality to not only present the content, but really model, that opportunity to, to really seize that moment and support, the way in which we all learn, which is in community. So thank you guys so much for doing this. Oftentimes I think we feel like, if I only had time to, heal, or I only had time to, right? And the challenge is we have to make that time, right? And we have to put it into spaces. So love that HICP has the flexibility to bring lots of different energy in, so that we can step forward, step back, and step into community together as we do this work. So my job today is to talk a little bit about the community benefit process, which we underwent in the last several months. Every month we're giving an update on our subcommittee progress. And that, as you recall, is the opportunity for us to come together as a small cohort of HICP representatives to address the Centennial project that is currently underway. As you all know, we're in an exclusive negotiating process with the Centennial partners, and they have taken the time to begin to envision the campus. As they were doing their work in the master plan, we in HICP and the subcommittee were gifted the time to engage as a subcommittee, so that we all can work together to look at those major opportunities in this project for community benefit. And as you have heard from us over the last several months, we've taken each of 9 topic areas to ensure that we can really dig deeply into what is possible. And we learned about a month and a half ago that the way in which the county will engage Centennial partners will be through an option agreement. So what's going to happen there is that we are going to have an opportunity to not only give a framework, which is what we're presenting through this process to our developer, a framework for community benefit, but we will also have the opportunity to work on specific plan goals for each of their projects once they're in the process of being approved. So all of this time is really a gifted time, because on May 15th, and we'll hear from our development partners in a second, they will be releasing their master plan. And in a traditional development process, that starts a 45-day period for community input and community comments. We differently than that have been meeting right with the developer the entire time they've been at the table, and we also have engaged in this community benefit process. So I wanted to just give a little bit of context. And these are the 7 HICP priority areas that we drew from to identify the priorities within our CBA document. And I want to thank each and every one of our subcommittee members, because it was endless hours and days, in some cases, even time we didn't plan for, right, to ensure that we had enough of a dialogue before agreeing on what was in our document, in our framework document back. So we will be presenting that document here in the next month. I'm not sure if it's going to take only 1 meeting of HICP or 2, so please stay tuned. We might end up having 2 HICP meetings next month. But you know, we are going to have the opportunity to really engage with all of you and share with you the highlights of the recommendation, as well as, you know, some of the feedback from our developer, right, in that process of learning what are the priorities that are most important to us, and how can we then use that framework to guide some of the opportunities, right, that we're looking at in the planning process. So with that, I can maybe take me to the next slide. All right, so the purpose of the committee: to negotiate a legally binding contract with Centennial partners to ensure the community receives specific benefits from the project while fostering accountability and promoting community well-being. And through the series of meetings, right, our job was to refine, prioritize, and articulate specific requirements related to the community benefits, and work through continuing the work that was begun through our feasibility study, our RFP process, and now, you know, the dialogue with our developer and all of you through HICP. So I feel like we did the task that was to get us to a draft document for the developer. And then this month, what we're doing is we're going to be exchanging with our developer to learn more about the process, to understand what it takes to truly develop a framework process that is meaningful and useful, right, as we think about the planning of our engagement, not just with them as developers, but also sort of in our broader community context. So take me to the next slide. So the community members that were invited to be part of the steering committee served as proxies for the community voice, which is all of you, all of our broader community, right? To ensure that the desires of our community were well articulated in the process. And so it was important that you know, they actively participate. And I have to say, I was more than impressed with the level of commitment and accountability that folks shared. Next slide. All right, and here's an example, right, of our framework with all of the different areas. You've seen these before. I think rather than going through this, I also wanted to invite a couple of our CBA partners that are on the call to be able to share just what your experience has been participating in the CBA process. Because I feel like once we have the document, we're going to be able to go through some of the specificity, but I do want to make sure that we can articulate what our experience has been overall in this process, right, of a gifted time, really, with the developer that has not usually been business as, it hasn't been business as usual for the county. And really, I think because of the supervisor's vision around creating a healthy village, right, the opportunity that we now have to reimagine the campus and to have that specific context that helps us understand why we're here and why a public-private partnership on public land, right, could truly create something different for our county and our community. So with that, let me open it up to other partners to see if you would like to share a few words about your experience. And I may call on a few of you, but I hope that some of you can raise your hand and share some thoughts. So CBA committee members, anyone would like to share your experience?
You can get us started. Or, Yolanda, would you like to start or would you like me to? Yeah, I just want to share that it was definitely a great experience and it felt a little bit as coming full circle. As I shared, had the privilege of being at the Wellness Center for the last 12 years, but actually being involved with the project of the Wellness Center for the last 15 years. Before the Wellness Center was a Wellness Center, we engaged in discussions and planning and dreaming of what that space could be and become. And this process was unique of the CBA because of Supervisor Solis' commitment to inclusion and true community engagement, right? And having us in that space, sharing our perspectives, allowing us to share our ideas. And from my perspective, it was important to come together and dream together and talk about, a vision together. And as a member, just looking forward now to the next steps, which is, thinking through and then negotiating how do we operationalize a vision, right? How do we combine passion and pragmatism and bring forth the community benefits, right? Through a negotiation process, through direct engagement with the other stakeholders involved in this project. So once again, it was great to be in that space, to think of the possibilities, to be part of the vision refinement, and now looking forward to the next steps.
Thank you so much, Diego, for your insights. And again, just your active participation as well as our other partners to ensure that, we really took advantage of that time and space together. So thank you so much. Anyone else? Oh, Yolanda, let's go to you.
So I'm taking advantage as the oldest one in the room again. For my legacy with this project goes back to my grandmother and my dad. For my grandmother, it was her medical home. And for my dad, the dream was to bring this medical campus to the community so it would be truly accessible. This is a dream come true for him, I'm sure, on heaven that he's just smiling down on us. To Supervisor Solis, who has taken this dream and just expanded it to a new level and new heights, because this was always a medical campus. And so she's the one that made it an opportunity to address the homelessness and the need for homes in our community. So while it is not a housing project, it is going to be an answer to the housing crisis. And for that, I'm truly grateful. I know that working with all the community activists that she gathered around the table to represent our communities, that we will be able to find a good and solid answer that will ensure this project go forward. And for that, I am grateful, truly grateful to be a part of this history.
Yolanda, thank you so much. And you and Teresa, and those of you who have been through these types of processes, brought so much wisdom into the space and the opportunity to, have us think a little bit more about not just this opportunity in front of us, but about, what is possible when we are, at a table, at an equity table, right, with the county, and how, we need to continue to learn from the opportunities and past processes to support our opportunity, right, and be able to deliver what's being asked of us. I know that's always really hard too, right? That we want as much time as possible to negotiate, to imagine, right, what is possible on the campus, because it's a lot of responsibility that is on the shoulders of the proxies. At the same time, right, it's important to respond to that timeline that is given to us, right, and make sure that we can meet the demands. So just appreciating that, and that's why I mentioned that maybe next month we might need to have 2 meetings, because we need to get to a presentation of this framework, right, back to the county to fit the timeline. So thanks so much. Teresa, I see your hand up.
Yeah. Hi, good morning, everyone. And I think Yolanda and Diego have mentioned much of what I would voice as well. And I know that I can speak for them, if not many of us, that this is a very deep seated, passionate commitment that at least for myself, I've discovered is deeper than I ever thought. And so, as well as Yolanda, I have been at the table since Supervisor Solis with her vision and her caring and her influence and commitment to community, always at every level, has opened the way for this to be possible. And in my career, as I've shared, for those of you who have been around these conversations, maybe I sound like a disco rayado, like my mom would say, a broken record. But I have seen many of these projects, many of these initiatives flourish from the start, and the consistency and the persistence and commitment to it have, for many reasons, perhaps not found its way to where our work is today. And that's it's just I think a different ingredient in my experience. And so the long-term commitment for this and the infrastructure that supervisor has laid down for us to continue in the long term, and we're talking quite a few years into the future, continues to inspire me, and I'm grateful to have been a part of this. And yeah, I do have roots. My grandmother and tias and uncles, are part of the East LA experience and the entire district. And so there's a lot more to this that powers me. Thank you.
I think that's why there's so much care and passion in the process, because many of us have that opportunity of the historical context and connection of family, right? That we can bring into the space. So thank you all so much for your comments. I don't see any other comments from the partnership, and I know we're almost at time. So can you take me to the last slide, Christina? Would that be okay? I don't know who's navigating today. Maybe Elijah? Yes, thank you, Elijah. Yeah, take me to the last, that one. So it's not filling the entire screen. There we go. Thank you so much. So our work progress, May and June, is to finalize the draft framework shared with committee, right, and Centennial partners, participate in meetings between our committee and Centennial partners, to negotiate the final draft that will go to the Board of Supervisors in the option agreement package that the Department of Economic Opportunity is putting forward. The community unveiling of the master plan, which will be on May 15th. And I know Centennial will be sharing that a little bit more, but we have had a few open house meetings, including one this week on May 6th here at the Wellness Center in collaboration with Eastside Leads and Legacy LA partners. And we had a good 50 community members that attended. So we were really happy to see that folks were able to get their questions answered, and I'm sure we'll have questions here as well. So get your questions ready for our Centennial partners. Negotiations to arrive to a mutual document will be done by May 31st, and we are to vote on June the 5th. My concern is I don't know that we're going to have enough time, so I'm just kind of putting a little tickle there that we might need another meeting. But right now we are due to vote on the document here, or at least endorse the document at this table on June the 5th. And so special thanks to the community active engagement efforts. Those of you who are working so hard to make sure that we have representation at each of the meetings. Alma had one earlier this month. I think you guys had upwards of 60, 70 people. So thank you all so much again for your commitment to this process and for ensuring that the community voice is always at the table. And with that, I want to pivot to, I'm going to now facilitate the end of the meeting. And because Heather had to step out to another meeting. So we thank Heather for her incredible facilitation of our meeting constantly. But I will take now Centennial partners and we can bring up their presentation. And I will make sure that we invite both Giovanna Araujo and, we're going to do campus projects first?
Yeah.
Okay. I mean, I think Centennial, are you all ready?
We're ready to go.
Okay, let's do Centennial first, and then we'll come back to, because I feel like we're going to chop up the topic areas if we don't. Would that be okay?
Yes, that works for us.
All right. While he's getting the presentation up, can I switch it over to you, Giovanna, to get us started? And you'll see your slides in a second.
Yes, perfect. And to confirm, Elijah will be sharing the video today. We'll share the version in English. So I think you probably have it. Perfect. All right. I don't even need to worry about it. Good morning, everyone. Great to see everyone. Thank you again for having us. I'm Giovanna Araujo with Centennial Partners. We're here at a very exciting point in time, and Rosa and all of our community members here have been sharing a little bit about the CBA, a little bit about the release of the master plan, but this is truly an incredible milestone in the project. We've all been working really, really hard to get all of the documentation together that's going to be necessary for us to move forward toward implementation of the vision of the Healthy Village. And that includes the master plan, that includes the CBA, that includes a series of other documents, which we will touch on a little bit today. And it's a full suite that goes for approval to the Board of Supervisors at the end of the year. So it's a really exciting moment. We're preparing for the release of the master plan package next week on May 15th. And ahead of that release, we've been doing what we're calling a show on the road where we're making sure that we're stopping at the headquarters of our various partner organizations, at the Wellness Center here at HICP, with a presentation video that we've put together that introduces the master plan and also gives some of the background as well, as far as the process over the course of many years to get to this point. So this is a brief video, about 15 minutes, 17 minutes, and it kind of summarizes everything. We'll share that with you guys, and we'll open up for any questions, and it'll be a good introduction to what's coming.
So now I understand why they might have put you last because of the length of the video. So can we do this? Can we invite, and again, apologies guys, because I'm stepping in to facilitate here, but can we invite the arts program to like maybe take a couple of questions right now if anyone has questions for you, but then invite our arts partners to present, and then we can end with the video. That way, if people have to hop off, right, we didn't miss the arts presentation. Does that work for you, Giovanna?
Works for us, no problem.
Okay, thanks, Elijah, for navigating. Apologies to the changes here. Any questions for Giovanna while we're switching the video? And again, please stay for the video if you haven't seen it. It is a wonderful opportunity for us to learn more about the project, scope, and the opportunity of the campus reimagine and vision. So this is that community plan in a video form. So please stay tuned for that. All right, I don't see any questions right now, Giovanna. So let's switch over to Iris Regn, who is here with the Department of Arts and Culture to share with us an update on the Restorative Care Village 5.
Thank you so much, Rosa. And I'm sorry I'm off camera. I'm actually in transit. I'm sort of pulled aside to the side of the road. I am deeply honored to be able to present the final design for the mural on Mission Road. This has been such an incredible collaborative effort, and I just deeply appreciate the process for this and have huge congratulations for the artist Stephanie Mercado, who is also on this call. So I'm going to go through the mural, but I really want you to be able to speak with Stephanie directly. So this mural, next slide, is composed of 3 panels. It is, we were able to follow the co-design's guidelines of calm, but also joyous, and historical references. The theme of all the artworks in the building are healing plants, and you could see how that's reflected in the mural as a through line here. I know that the HICP had an engagement with Stephanie, and that was very, very valuable at the onset of the project. Stephanie decided to take this idea of the luminaries or historical figures and sort of generalize them more into symbols that she works with. So you can see historical moments represented sort of more symbolically. And I just wanted to talk about the overall mural, and then we'll go to each panel. So the overall mural, you could see how the through line are these historical, healing plants. Next slide. And this is how the mural sort of functions on the building. So there are opportunities to see a lot of details and symbols up close, and then there's certain things that get seen from afar. So on the central panel, that's probably the main panel that will get seen from the freeway, and you could see how there's certain elements that pop out. And then from drivers on the road or from people walking on the sidewalk, the there's sort of a different scale of elements. So this mural functions in sort of on multiple scales and from different perspectives. And all those perspectives were very much taken into account in the overall composition of the parts. Next slide. So on the far left side, you could see the representation of LA General and the neighboring community and lots of other little Easter eggs. I just wanted to point out, obviously, the pagoda, the farm workers on the left, the acknowledgement of the Women and Children's Memorial that you see, the oak tree that's so central to this campus, and even an acknowledgement of, you could see the little children jumping up and down near the oak tree that refers back to the child care center. So that's sort of past, present, future, all in this one panel that talks about this space and the surrounding communities. Next slide. This panel features one very prominent figure that is Toy Purina. And you can see lots of symbols, the red poppies, the butterflies, the iconic palm trees, the hills with the houses surrounding nearby, and just all in sort of a spirit of growth. The central tree, this is really a very hopeful and foundational panel. You can also start to see on there's so many details here, so I'm just going to point out tiny bits. You can also see the cars, the lowriders sort of starting to parade on the lower part of the panel. Next slide. And they continue on onto this slide. And here there are a lot of references to the future and hope, and also very specific references to the hospital and the medical profession and the healing that happens in this place. And also there are many different sort of cultural symbols nested within this panel. I think I'm going to leave it at that because I really want you to have time to speak with Stephanie and ask for questions. Ask questions. Next panel. Oh, yes. If maybe the central panel, the one that shows all three. Thank you so much. Anyway, so much gratitude for this process, so much gratitude for everybody's input and collaboration on this. I wanted to say that we're now in the process of the fabrication. Samples have been developed and final details for the attachments to the building are happening, and installation will be happening in September. And if you haven't already, definitely go by the building, which is turning out to be an incredibly beautiful building. And you can see the space where the mural will be, and see what I mean about sort of the different angles, the viewing angles. So much joy is all I could say. So with that, I'd love to open to questions, and I know Stephanie, I saw her online, and I know she wants to hear any comments. Thank you so much.
I'd love to bring Stephanie forward. How are you, Stephanie? Thank you so much for, just your creativity, inspiration, and passion, right, for our culture and our ability to truly transform, thoughts and ideas and feelings into art in this beautiful way. So
Oh, thank you so much, Rosa.
You and Iris can, take any, I don't know if you want to share anything more about your piece and your process, and then we can maybe take some questions, and I'll monitor the hands up and the chat.
Sure. I apologize that my camera is not working. I have an old laptop. I am here, and I thought it would show my photo, but it doesn't. But I echo Iris's gratitude to the community, which really did help shape this mural. I took everyone's feedback and tried to incorporate it into a design that really does reflect the village and community aspect of the hospital, but also nodding to the past. Toy Purina, the indigenous presence in the area, the Brown Berets, everything that has really shaped Boyle Heights and East LA and Los Angeles as a whole. So I am very grateful for this opportunity. It was an amazing dive into research history, not only culture but also plants. I learned a lot from researching healing plants, and for me that was a way to connect with my indigenous background. So I'm happy to answer any questions that anyone may have. I am here, and again, I apologize that my face is not showing up on the video.
Thank you so much for that. And I think, you're not only doing, the work of, just creating an imagery that helps bring people to, to the calming that, that is needed in a building like this as you enter. But also, I think the connection, as you were saying, to the references of art and history, and so you accomplished so much, and just appreciating you for that, and for your openness, right, to dialogue with the community about this and about what's possible. So you're getting, just comments in the chat about just how beautiful this is, and asking, for, well, just acknowledging that people are excited about your project. I was going to say, asking for, when you will start. I know it was said briefly, but when you'll start putting some of the art, so that if people would like to stop by and see the process in action. I did hear September, but is there like a true start date that you all are thinking about in terms of when this will be going up?
Yes, we hope to install at the end of August, and so it should be ready on the building sometime in September.
Beautiful. So if people would like to stop by, in late August, they can see you in action.
Yes, we will be there installing diligently and taking any comments and questions for anyone who comes by to visit.
Wonderful. Thank you so much. Yolanda, I see your hand up.
Whoops, just briefly, thank you so much, Stephanie. What a beautiful job. And for a medical campus to have a quiche medicine woman right up front, it's so inspirational. It is a nod to our past, our ancestry, and absolutely a look forward generations to come. So thank you so much. What a brilliant piece of work. And I said it in the text, we couldn't have done this without Iris and her knowledge and patience and a depth to put some of us together with beautiful artists like Stephanie and come up with a project like this. So thanks.
Thank you, Yolanda. I echo your comment. Iris has been amazing to work with, and she really did help me think about scale and how people will be able to experience this.
So much appreciation to Department of Arts and Culture, because I think there's the art, opportunity, and then there's working through the county process. So it sounds like, there's a real skill and way in which our department is able to connect with artists. And so thank you so much, Iris, to you and the department for your support of beautiful opportunities like this.
Thank you so much. I'm seeing a little comment in the chat about postcards. I love that. We're all on the same page thinking about all of what comes next, all the little extra goodies. So Rosa, I know you're going to be a part of that conversation for sure.
We're here to help, absolutely. All right, with that, I want to then pivot over to our video if we have no other questions for Stephanie or Iris. All right, we look forward to seeing you in action. Stephanie, and again, thank you so much for your commitment to this project. All right, I'm going to bring up Giovanna again, and I know you already did a bit of an introduction, but I don't know if you want to share anything more, you or Claudia, before we get the video started. I do want to say that I will stay on to conclude the meeting, but if you need to leave, before the meeting is over and you've already seen the video, we completely understand and appreciate you and the time that you spend in the Health Innovation Community Partnership space. So stay tuned for our meeting schedule for June, and appreciating everyone so much on this second week of May. Happy Mother's Day to those of you that are mothers. All right, Giovanna?
Thank you, Rosa. Nothing else really to add. Excited to share this with everyone. Thank you to everyone who has already seen it. Thank you to everyone who is able to stick around to see it. And if you have any questions, you can share them with us in the chat. You can also email Claudia and myself, and we'll be sure to respond. So thank you all.
Welcome to the future grounds of the nation's first regenerative care destination. My name is Giovanna Araujo, and I'm the project director with Centennial Partners, the development team working in partnership with Los Angeles County to bring the redevelopment of the historic General Hospital and its 40-acre site to life. The communities of Boyle Heights and the surrounding neighborhoods have been shaping the vision for this project for over a decade, showing up again and again with care, patience, and commitment. Our role as your developer is to bring you the tools that help turn vision into reality. We are honored to have spent the past 2 years learning from you. Over the past 6 months, we've worked together to build on the vision and translate it into a master plan that can carry the project into implementation. There is a lot to take in with a project like this, so we want to walk you through it, starting with the community vision, the history of this place, the redevelopment process, and then moving into the design of the master plan. You believed that we could reclaim this land and restore it, even when things felt too complex to fix. This campus has been healing Angelinos for generations. As the General Hospital, affectionately known as the Great Stone Mother, begins a healing journey of her own, we prepare her to care for us in ways that meet today's needs and those of the future. Healing is hard. It asks us to take things apart and rebuild them with intention. But vision carries us forward. The trust that something more whole, more beautiful, awaits on the other side. We call this vision the healthy village, and it begins with 2 simple ideas. What if we created a vibrant cultural destination for Los Angeles, full of food, art, and everyday life? And what if it were also a place that prevents crisis and holds people when they need care? These aren't competing ideas. They are deeply connected. The communities surrounding General Hospital, Boyle Heights, and the region are among the most vital in Los Angeles. Families have built lives, culture, and civic identity here. These communities gave rise to the 1968 student walkouts. They sustained decades of labor and immigrant rights organizing, and they have produced traditions of art, music, and public life that have helped define the city. Los Angeles has drawn deeply from these neighborhoods, their labor, culture, imagination, and resilience, and too rarely invested back at the level they deserve. life expectancy in these neighborhoods runs shorter than the city average. Residents face higher rates of food insecurity, and the neighborhoods rank among the most park deficient in the county. These gaps fall disproportionately on Latino residents, who today face renewed anxieties about belonging and safety as immigration enforcement and political rhetoric intensify. It is in this context that the General Hospital stands as a promise that the most vulnerable are to be treated with dignity. Etched into its lobby walls is a simple but powerful commitment that no one would be denied care for lack of means. Like many institutions, its story carries both hope and hard truths. General Hospital is nationally recognized for pioneering modern medical training and research. But there were moments when harm was done, particularly to Latino women subject to coerced sterilizations when giving birth at General Hospital, a practice later challenged by the landmark case Madrigal versus Killigan. These histories matter. They remind us that accountability must be part of any path forward. After the 1994 Northridge earthquake, the building was taken out of service because it no longer met seismic standards for medical care.
The revisioning of the General Hospital and its 40-acre site into the Healthy Village is grounded in the social determinants of health, the understanding that health is generated through more than medical care. It's everything that shapes a person's life: housing, food, nature, safety, opportunity, and connection. When those needs are met, we see real change, less violence, fewer people entering the justice system, and stronger communities. It is more effective and less costly.
And yet, there's no precedent for this. Projects where a historic landmark, a cultural destination, and housing come together within an active medical campus.
This site is perfectly positioned to lead the way. Just steps away, Los Angeles General Medical Center, the county's #1 trauma center, serves thousands of patients, families, and healthcare workers daily. At the corner of the site, the restorative care villages provide a full continuum of care: recuperative care beds, supportive housing, and behavioral health. At the heart of this ecosystem, the Wellness Center is already operating on site as a one-stop hub for over 15 community-based organizations offering wraparound services from mental health support to housing assistance.
The General Hospital has always made history, and that legacy will continue. When this village succeeds, this project will become the second largest adaptive reuse public-private partnership in the nation, and Los Angeles will gain a replicable national model of integrated health urbanism and community-driven development. At the hospital's Centennial, a rare window of alignment has opened, bringing together government leaders, private partners, and the community, all saying yes to delivering on the mission of this redevelopment. Work of this scale requires people in service of something greater. For this reason, the project is structured as a public-private partnership, when the government and the private company work together to fund, build, and operate a project that serves the public. Our development team, Centennial Partners, named to celebrate the building's 100 years, is here as Latinos and advocates from Boyle Heights, born in General Hospital, immigrants. We were tired of waiting for change, so we became developers. We want to be clear. This site remains publicly owned. It belongs to you, and that will not change. When the Centennial team was selected as a project partner, we entered a 3-year process with the county. In the first phase, we studied all existing materials that captured community needs, site constraints, and government processes to plan the project approach. We then secured funding to break ground. In the second phase, where we are right now, we worked with you to design the master plan. In the next phase, we'll be securing project regulatory approvals. And then we'll be on our way to construction. This moment has been made possible through extraordinary public leadership and investment. Under the leadership of Hilda Solis, the county secured $120 million in public funding from state and federal sources to launch the stabilization project, a critical step to immediately improve the site. The work of the stabilization project includes seismic strengthening of the hospital, and we break ground this summer. The overwhelming support for the stabilization project and the master plan reflects years of consistent community engagement. In collaboration with a broad network of community stakeholders, we deployed a toolkit to reach different audiences: pop-up outreach, participation in existing forums, small group meetings, advisory committees, and community at large workshops to build awareness and make decisions together. A clear set of project priorities have consistently been expressed. These include attainable housing for a range of incomes, expanded mental health and supportive services, access to healthy and affordable food, safe and dignified public spaces, improved mobility, support for small businesses, and pathways to local jobs and education. For the master plan specifically, we conducted 2 community at large meetings. We learned key factors that make people want to spend time on the site and the most desired amenities. What you see in this master plan package is not a rigid blueprint. It is a framework for possibility. The drawings you see in the package illustrate one potential outcome among many that could unfold within this framework. This is called a programmatic master plan, intentionally designed to be flexible so the site can grow and evolve over time. It establishes the street grid, circulation networks, and relationships between housing, services, local commerce, and open space, but it does not prescribe the exact form of every building. By planning at this level, we can secure approvals more quickly and move into implementation sooner, advancing in months rather than years. Instead of locking in every detail up front, that design work continues over time, allowing each phase to respond to real needs as they emerge. The programmatic master plan is one document within a suite of project documents that are adopted by the Board of Supervisors, and that will be released publicly separately over the course of the coming months, including strategies to reduce environmental impact, rules for what we can build, and community benefits we have to provide. So how do we design a place that is both a cultural destination and a generator of health? This is achieved through what we call common ground. On the ground level, you will find local shops alongside nonprofits and spaces for community services, stitched together by restorative landscapes. The General Hospital ground floor, for example, is being reimagined as an interior street. Here and throughout the site, storefronts are right-sized so families that may be running home-based businesses can afford them, capturing the creative and entrepreneurial spirit of our communities to offer an authentic experience. At the heart of the site is a central park, a shared gathering space that connects the historic General Hospital to the new development and naturally draws people together. The site is organized around 3 distinct hubs: healthcare at the medical center, the new hub, and the historical heart, General Hospital. They're all connected, so it's easy to move between them. You can find your way without needing a map. These hubs are connected by a network of meandering paths lined with parks, plazas, and courtyards that stitch the campus together, each with its own character. Everything on the site is within a short walk, 5 to 15 minutes, and these connections become intentional corridors, the community corridor and the wellness corridor. New arrival gateways make the site highly interconnected and open to the surrounding communities. The 3 hubs are accessed through key entry points along Mission Road, Zono Avenue, and Marengo Avenue, where you will arrive at mobility hubs with parking, bus stops, and rideshare drop-offs at the perimeter. Once you arrive, the site opens into a network of walkable and ADA-compliant paths designed entirely around the pedestrian and bike experience, creating a fully vehicle-free environment. Vehicle access is controlled by bollards. Streets are sized to accommodate emergency and occasional access, but are otherwise limited to keep the campus pedestrian-focused. Internal mobility is supported by shuttles and other flexible transit options that make it easy to move around the site. This enables fitness trails and coherent bike paths. The result is a vibrant site where different rhythms of life intersect and flow. You can drop your child off at daycare, walk to get coffee, pick up groceries, attend an appointment. It becomes the center of gravity for the surrounding neighborhoods. At its heart, the plan functions as a new kind of mini downtown, a place that is active throughout the day and night, where errands, social life, and essential services naturally overlap. Above the common ground is housing. The General Hospital will be reborn as a mixed-use residential tower designed to preserve historic features and to blend indoor and outdoor through carved-in amenities. Housing here and throughout the site will be delivered as a full spectrum. The housing crisis can't be solved by any one solution alone. By using more efficient and innovative construction methods, we can reduce costs and make housing affordable at scale. This is an illustration of one possible way the buildings could take shape. Final designs will be defined later, but what's important here is the programs, which came directly from your input. Grocery stores, cultural spaces, libraries, community centers, playgrounds, urban farming, art installations, rooftop restaurants, mobility hubs. The list will continue to grow. The landscape helps regenerate the land and bring back native plant and animal life by restoring lost habitats. The master plan integrates a range of sustainable technologies, from electrification and renewable energy to stormwater capture, drought-tolerant planting, and smart building systems. The community corridor comes to life with spaces to pause, gather, and experience events, while seamlessly connecting the General Hospital to the new hub across the site's elevation changes. The slope is used as an asset, helping manage water through circulation and retention strategies, including green roofs and rainwater harvesting. The wellness corridor is designed specifically with the LA General Medical Center staff in mind, in response to what you've shared you're missing: a place to step away, recharge, and take a real break, with shaded seating and convenient restaurants. When a place is made with care, we feel it. Space for children to play, somewhere for elders to sit, to share a meal with neighbors. It is in these everyday moments of connection that the character of a community is made. This is our shared legacy. We are all friends of the historic General Hospital. You can find more on our website, and you can share your thoughts via our survey. Please reach out to us anytime. Thank you.
Thank you so much, Giovanna. Really appreciating your opportunity here for people to see the master plan in a visual space and in a way that could be, shared with others. Sometimes it's really hard, right, to translate planning documents into everyday conversation. So thank you for your incredible, just thinking around how to do this and the partnership with us, right, and sharing every aspect and phase of your process. So thank you so much.
Yes, thank you all so much, and thank you to everyone who's been giving feedback and helping us to make sure that we're telling the story in a concise, but in a way that still captures all of the key elements that everyone should be made aware of. The video is intended as a bit of a teaser, there's many threads to pull on. So of course we expect that questions will be coming through. I know that there was already a question in the chat about how to access the video. We'll be making it available on our website. It will also be linked in the master plan package. We'll probably put it up on YouTube. Just any ways that there's links that can go out far and wide. The idea is that it's your video, so you can watch it, you can pause it, you can zoom in, you can really kind of sit with it at your own pace. So this week, as the master plan gets released, the video will be released for public consumption as well.
Awesome. Well, thank you so much again, Giovanna. Thank you to Centennial Partners and all of your effort. Thank you, community partners, for listening through these, coming to some of the community meetings, and continuing a dialogue with us as we continue into the next phase of sharing and collaborating with Centennial Partners, with Department of Economic Opportunity, with our partners at the table here to ensure that we can bring the best project forward for the community. So with that, thank you everyone for sharing space in the Health Innovation Community Partnership, and we look forward to seeing you next week. Christina, do we have a slide of the next meeting?
We do. So next meeting will be
All
Friday, June 5th. And we also would love if we know we're out of time, but if there's any updates any partners have or events, we also send a monthly newsletter to our HICP community. Happy to send that out. I did put my email in the chat. If there's a flyer or announcement that you'd like us to share, please email that my way, and I will happily send that out with the presentation materials for this call.
Awesome. Well, thank you again, everyone. Appreciating you, and have a beautiful rest of May, and happy Mother's Day to all the moms.